We'll now call on Congressman Brian Higgins. Welcome, Brian. It's wonderful to see you here, and you have 5 minutes to present your proposal.
Yeah, thank you very much, Chairwoman Estu and Chairman Pallone and Ranking Member Burgess. I just want to say that I was a proud supporter of the Affordable Care Act, which will be 10 years old this March. But even the President, the Speaker, recognized that the passage of the Affordable Care Act represented a start, not a finish, and that it was highly imperfect in many ways, including the lack of a public option to be a real countervailing force to private insurance, because I think by and large, private insurance screws people. They jack up premiums, they jack up deductibles, they jack up copays, and then when you go to use the insurance that you already paid too much for, there's very little underlying insurance. You know, before the Affordable Care Act, if you had a kid that was stuck with childhood cancer, an insurance company could deny you coverage because of a pre-existing condition. You can't do that anymore. It's against the law. And the only federal law that protects people with pre-existing conditions is the Affordable Care Act. And 2010, Democrats lost control of the House because of health care. 2018, Republicans lost control of the House because of health care. We're even. Let's move forward. I want to talk about three things: complexity, cost, and leverage. The human body has 11 organ systems. There's 70,000 ways that those organ systems can fail. There's 4,000 medical procedures. There's 6,200 FDA-approved prescription drugs. There are 206 bones in the human body. There are 30 trillion cells and 200 cell types. The human body in healthcare is fascinating but complicated. The United States government pays $1.3 trillion for healthcare this year under Medicare, Medicaid, and the Veterans Administration. Then another $360 billion in prescription drugs. That's a lot of money. The federal government pays about a third of the nation's entire health care bill. But it's also a lot of leverage, and that's what I want to talk about today. All of these bills are outstanding. We need to make progress by using the best public option that already exists, and that's Medicare. Medicare has been around for 54 years. It is wildly popular with those who have it and those who provide services for those who have that as their health insurance. 96% of Medicare beneficiaries have access to both a primary care doctor and a physician specialist, and all of the hospital institutions take Medicare as well. I have a bill that would allow people 50 to 65 to buy Medicare as a medical option. The Henry J. Kaiser Family Foundation, that has done extraordinary work in this regard, says that 77% of the American people support a Medicare buy-in 50 to 65. Why that age demographic? Because this age demographic, 50 to 65, is to this century what the traditional Medicare population was to the previous century, and that is that private insurance had every opportunity to write policies for people that were older and sicker but chose not to do it. And a good and generous nation responded by establishing the Medicare program. And then all the privates wanted in on it when it was deemed to be profitable and successful under the Medicare Advantage program. This age demographic experiences very high pre-existing conditions, about 50%. Their premiums are very high, their deductibles are very high, and their copays are very, very high. Give you an example. A 60-year-old able to buy into Medicare at their own cost that will not adversely affect the Medicare Hospital Trust Fund, according to the Rand Corporation and the Henry J. Kaiser Family Foundation, would save 48% when compared to a gold plan on the individual market. Now, Rand also said that 6 million Americans would take advantage of that plan. That's almost 14,000 people per congressional district. And I would remind you that that age demographic also votes. So it's good on the politics, it's good on the substance. I think we have an obligation to, much like we said 10 years ago, we need the next iteration, the next exciting iteration of Medicare expansion, and I believe that my bill should be in that conversation relative to that goal. Thank you very much.